Factsheet: No coronavirus history. Facts: symptoms, treatment for 2019 nCoV. Wuhan is the capital of Hubei province and is the 7th largest city in China, with a population of more than 11 million people. It is a major transportation hub of the country. China has locked down 18 cities at the hub of a new coronavirus outbreak that has killed 41 people and infected at least 1,300. The lockdowns on new cities affect more than 56 million people. China's finance ministry said it was allocating 1 billion yuan, $145 million, in funding to the Hubei provincial government to help with efforts to contain the coronavirus outbreak. Hubei has been the region hardest hit by the outbreak, which began in the province's capital, Wuhan. As of January 29, 2020, approximately 6,161 cases have been confirmed, including in every province of China. The first confirmed death from the coronavirus infection occurred on January 9, and since then 132 deaths have been confirmed. The Centers for Disease Control and Prevention, CDC, continues to closely monitor an outbreak of a 2019 novel coronavirus, 2019 nCoV, in Wuhan City, Hubei Province, China that began in December 2019. CDC has established an incident management system to coordinate a domestic and international public health response. The name coronavirus is derived from the Latin corona, meaning crown or halo, which refers to the characteristic appearance of the virus particles, virions. They have a fringe reminiscent of a royal crown or of the solar corona. Coronaviruses are a group of viruses that cause diseases in mammals and birds. In humans, the viruses cause respiratory infections which are typically mild, including the common cold, but rarer forms like SARS and MERS can be lethal. In December 2019, a pneumonia outbreak was reported in Wuhan, China. On December 31, 2019, the outbreak was traced to a novel strain of coronavirus which was labeled as 2019 nCoV by the World Health Organization, WHO. The new virus 2019 nCoV is not SARS, severe acute respiratory syndrome, though both are coronaviruses. SARS was first identified in April 2003 by the CDC. Another deadly acute respiratory disease caused by a coronavirus is MERS, Middle East Respiratory Syndrome. MERS was first identified in 2012. 2019 novel coronavirus, 2019 nCoV, is a virus, more specifically, a coronavirus, identified as the cause of an outbreak of respiratory illness first detected in Wuhan, China. Early on, many of the patients in the outbreak in Wuhan, China reportedly had some link to a large seafood and animal market, suggesting animal-to-person spread. However, a growing number of patients reportedly have not had exposure to animal markets, indicating person-to-person spread is occurring. At this time, it's unclear how easily or sustainably this virus is spreading between people. What is 2019 novel coronavirus? The 2019 novel coronavirus, 2019 nCoV, is a new virus that causes respiratory illness in people and can spread from person to person. This virus was first identified during an investigation into an outbreak in Wuhan, China. How does 2019 nCoV spread? Coronaviruses are a large family of viruses that are common in many different species of animals, including camels, cattle, cats, and bats. Rarely, animal coronaviruses can infect people and then spread between people, such as with MERS and SARS. When person-to-person spread has occurred with MERS and SARS, it is thought to have happened mainly via respiratory droplets produced when an infected person coughs or sneezes, similar to how influenza and other respiratory pathogens spread. Spread of SARS and MERS between people has generally occurred between close contacts. It's important to note that how easily a virus spreads person to person can vary. Some viruses are highly contagious, like measles, while other viruses are less so. It's important to know this in order to better understand the risk associated with this virus. While CDC considers this as a very serious public health threat, based on current information, the immediate health risk from 2019 nCoV to the general American public is considered low at this time. There is much more to learn about the transmissibility, severity, and other features associated with 2019 nCoV, and investigations are ongoing. The exact way the virus is spread is not fully known. With similar coronaviruses, MERS and SARS, person-to-person spread is thought to have happened mainly via respiratory droplets produced when an infected person coughs or sneezes, similar to how influenza and other viruses that cause respiratory illness spread. There also may be some spread when a person touches a surface or object that has virus on it and then touches his or her own mouth, nose, or possibly their eyes. Spread of SARS and MERS between people has generally occurred between close contacts. There is much more to learn about 2019 nCoV and investigations are ongoing. This 2019 nCoV virus does seem to be able to spread from person to person, although it's not clear how easily this happens. What are the symptoms of 2019 nCoV? Patients with 2019 nCoV have reportedly had mild to severe respiratory illness with symptoms of A. Fever, B. Cough, C. Shortness of breath, D. Many patients have pneumonia in both lungs. CDC believes at this time that symptoms of 2019 nCoV may appear in as few as 2 days or as long as 14 after exposure. This is based on what has been seen previously as the incubation period of MERS viruses. How can I help protect myself? The best way to prevent infection is to avoid being exposed to this virus. There are simple everyday preventive actions to help prevent the spread of respiratory viruses. These include: A. Avoid close contact with people who are sick. B. Avoid touching your eyes, nose, and mouth with unwashed hands. C. Wash your hands often with soap and water for at least 20 seconds. If soap and water are not available, use an alcohol-based hand sanitizer. If you are sick, to keep from spreading respiratory illness to others, you should: A. Stay home when you are sick. B. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. C. Clean and disinfect frequently touched objects and surfaces. What should I do if I recently traveled to China and got sick? If you were in China within the past 14 days and feel sick with fever, cough, or difficulty breathing, you should get medical care. Call the office of your healthcare provider before you go, and tell them about your travel and your symptoms. They will give you instructions on how to get care without exposing other people to your illness. While sick, avoid contact with people. Don't go out and delay any travel to reduce the possibility of spreading illness to others. Is there a vaccine for 2019 nCoV? There is currently no vaccine to protect against 2019 nCoV. The best way to prevent infection is to avoid being exposed to this virus. Is there a treatment for 2019 nCoV? There is no specific antiviral treatment for 2019 nCoV. People with 2019 nCoV can seek medical care to help relieve symptoms. What to do if you are sick with 2019 novel coronavirus, 2019 nCoV? Stay home except to get medical care. You should not leave your home, except to get medical care. Do not go to work, school, or public areas, and do not use public transportation or taxis. Separate yourself from other people in your home. As much as possible, you should stay in a different room from other people in your home. Also, you should use a separate bathroom, if available. Call ahead before visiting your doctor before your medical appointment. Call the healthcare provider and tell them that you have, or are being evaluated for, 2019 nCoV infection. This will help the healthcare provider's office take steps to keep other people from getting infected. Wear a face mask. You should wear a face mask when you are in the same room with other people and when you visit a healthcare provider. If you cannot wear a face mask, the people who live with you should wear one while they are in the same room with you. Cover your coughs and sneezes. Cover your mouth and nose with a tissue when you cough or sneeze, or you can cough or sneeze into your sleeve. Throw used tissues in a lined trash can, and immediately wash your hands with soap and water for at least 20 seconds. Wash your hands. Wash your hands often and thoroughly with soap and water for at least 20 seconds. You can use an alcohol-based hand sanitizer if soap and water are not available and if your hands are not visibly dirty. Avoid touching your eyes, nose, and mouth with unwashed hands. Source: CDC, NSIRD. CDC, the Centers for Disease Control and Prevention. NSIRD, National Center for Immunization and Respiratory Diseases, Division of Viral Diseases. Reality Views by SM.